So you're saying that celebrities don't just secretly steal hair from guys like these?
Matt, you can't transplant guinea pig hair.
Okay, got it. Just exploring my options. So Dr. Pat, a hair transplant. I'm a hypothetical famous actor with unlimited time and budget to get one. 2 questions. Do they actually work? And is it gonna look like real hair?
Yes, they do work, and with some of the more modern techniques in hair transplantation, it actually can really look much like your real hair.
Okay, so what exactly is the procedure for a hypothetical movie star just like me?
So it's a cosmetic procedure that involves harvesting hairs from one location and then planting them in the locations where you do not have hair. The non-DHT sensitive hair follicles replace the ones you've lost.
Okay, got it. So you're moving hair from areas of your head where they're not falling out to areas where they are.
Right, Matt.
But Dr. Pat, we all had a high school math teacher whose hair plugs were not quite convincing. I'm sorry, Mr. Wilson. Should I be afraid of the result of my hair transplant?
No, plugs are really an older method for hair transplant. What they did was they grouped hair follicles together and formed a plug and literally implanted them in different areas of the scalp. It ended up showing a fair amount of gaps between the plugs, and in many cases just did not look natural. Today we have modern techniques of hair transplantation that are much more sophisticated. Surgeons can harvest hairs using FUE and FUT methods.
So we gotta figure out if I'm a FUT or if I'm a FUE person.
FUE, F-U-E, is a follicle unit extraction. What we mean by that, it involves removing single follicle units or individual hair follicles and actually transplanting them into new areas. The surgeon may make very small indentations or areas for these follicles. They're called micropunches to remove hairs from the scalp with minimal scarring. The advantage for FUE is that it doesn't produce a large scar. Instead, it creates hundreds of tiny scars, which are really not that noticeable once the hair starts coming in, and it heals fairly quickly. People with light hair might not be able to completely cover a traditional strip method spot using a hair transplant.
So blondes and redheads who love to rock a buzz cut, this one's for you.
Absolutely.
Okay, so what about the foot one?
Foot, or follicle unit transplantation, is harvesting a strip of healthy hair from a donor. Generally, this is near the back where it's less noticeable. So you take a section of hair out, usually in the back of the scalp, and then you transplant it. The strip of donor hair is removed and then replaced or put in the thinning area of hair on the scalp. The advantage to the foot is that it actually has a higher survival rate and is a little less invasive than using the FUE.
Okay, so how long do these surgeries take and what's the recovery time?
Again, you have to look at the FUE versus the FUT. The FUE can take longer than the FUT and is often more suitable for smaller areas, while the FUT, where you're transplanting an entire strip, works better for larger areas of hair loss. The procedure can be done in an outpatient setting, and it can take anywhere from 4 to 8 hours to complete. Some implants can take a few sessions, so they don't do it all at once. They have you come back in successive appointments if you have a significant area that needs to be transplanted.
What about like washing my hair and putting on shirts?
You'll be able to gently wash your hair 2 to 3 days after the procedure, but you'll be cautioned against using any type of clothing that's causing any traction or tension on those newly implanted hair follicles.
Right, so zip up hoodies and turning my Zoom camera off while I heal, got it. Oh wait, no, hypothetically, I'm a famous movie star. That means fancy hotel rooms and avoiding the paparazzi.
You're really into hypotheticals, Matt.
And how much will this normally ding my hypothetically unlimited credit card?
Anywhere from $3,000 to up to $15,000, depending on how much hair needs to be transplanted.
Are there any side effects to consider besides the adoration of my hypothetical fans?
Well, any surgical procedure can have potential side effects. And the surgeon will explain all of those to you up front. So first, there's localized issues. That's pain and swelling, there can be infection at the implantation sites, there can be scarring, there can be cyst development on the scalp where the implants occur or where the strips are taken out. And then you can have complications from surgery. That includes anesthesia complications. If you come in with any pre-existing chronic medical conditions, that puts you at a higher risk for surgery. But all in all, it's a surgical procedure that is low risk, but it does cost a fair amount, and it has some potential side effects of localized swelling, discomfort, and infection.
Okay, and does it ever not work? Kind of like the time I tried a mullet in the 9th grade?
It's important to remember, Matt, that if your hair is genetically sensitive to DHT, it may continue to fall out even after you have it transplanted. It's case by case, of course, Matt, but I would advise considering other non-surgical hair loss treatments like minoxidil and finasteride, because irregardless of the transplant, you're going to probably need to be on those medications going forward.
That makes sense, since you'll still need to use those medications, even if you get a hypothetical hair transplant.
Correct.
Plus, no guinea pigs or movie star budgets required, right?
Right, Matt.
Thanks for watching another episode of Uncomfortable Questions. Make sure to like and subscribe below for more content like this. And Dr. Pat, do you want me to sign anything? My hypothetical autograph is worth millions.
I think I'll pass, Matt. Thanks.
Like hypothetical pass or?